you guys? It is Kyra.myi, and I am sitting down filming a video. Like, this is crazy. I feel like I have not done this in at least a good 2 months, and I really haven't, because even what I have been posting have just been vlogs, and I'm just kind of like, this is so weird. But I've been meaning to sit down and film this video. I'm also actually gonna film multiple videos today, and today is Thanksgiving. Obviously I can't be with my family. As a matter of fact, I have a mandatory COVID-19 test on Monday, and I just can't chance it right now, so I did not go home for the holidays. I'm kind of just like chilling, doing the whole social distancing thing, which is okay. But in today's video, I am going to talk about working in healthcare during the pandemic. Question number 1. Have you been exposed to COVID-19? So if you guys don't know, in the beginning of my healthcare career, basically, I had to do an externship, internship, whatever you want to call it. I had to complete 180 hours before I could technically be a registered medical assistant. So those 180 hours that I completed, I know I told you guys that it was an urgent care, but I'm not sure how far into detail I went, and I don't know if I told you guys that the place that I completed my externship hours at was actually a testing site for COVID-19. So I can't say, like, some healthcare workers are like, yeah, I'm sure I've been exposed, but I don't know, and that's because they work at different type of practices. But I can for sure say that I've been exposed to COVID-19 multiple times, because I worked at the testing facility. Like, what do you mean? So the facility that I worked at that actually did COVID testing is something about like their insurance and stuff. I don't know. I can't go too far into detail because I don't work in the administrative side of healthcare, but it's something to that extent where they don't get paid for telemedicine at that particular clinic. So when you go to the drive-up COVID testing facilities and you don't actually come inside the building, it's kind of considered telemedicine. And where I work, we didn't get compensated for that, so the people had to come inside the building. We had to basically kind of do like a full exam on them to a certain extent, if that makes sense. And we did a lot of self-swabs. We let people swab themselves unless they couldn't, and then we would do it for them, or unless they were a child. So basically, even if they were COVID positive, they had to come inside that facility, and we had 2 dedicated rooms for COVID testing. And at first, okay, so when the numbers started to spike again, I literally got to see that up front happen, because I was doing so many COVID tests and they were all just negative, negative, negative. Like, these people didn't have COVID, but they were getting tested. But then towards the end of my time at that particular facility, I think I had maybe 10 positives in literally 1 day, because we would get the results back within 2 to 3 business days, because we sent them out to the lab. So they would come back and we had to go through the list and call the people, and we had so many positives. And actually the one of the providers that worked at that practice had to like notify me, like, hey, you were exposed to COVID, because literally I had so many positives in 1 day. And I remember that day because I was thinking in my head, like, why are everybody getting tested in these particular days? Like, I don't know. Are you afraid of possibly contracting COVID-19? So basically, by the time my externship ended, I was no longer really afraid of COVID, just because of the fact that I knew I had been exposed, and I was also working retail at this time. So it's like, basically, if it was gonna get me, yeah, it was going to get me. So I was getting COVID tested basically like every week, and they were all coming back negative. So to my knowledge, and I'm talking about when the pandemic really hit and got big, because I don't know, maybe before, but when it got big, to my knowledge, no, I have not had COVID-19. All my tests have been negative, and like I said, I'm taking another one on Monday. So moving on to my next clinic, I really at this point wasn't afraid of COVID. Like, I know it's real. Like, yeah, COVID is real. It's not for play. But at this point, I wasn't afraid, because I was like, you know what? All I have to do is wear my PPE and stay prayed up, because I've been exposed to so many patients with COVID. And unfortunately, fortunately for me, I have not had it. But unfortunately for a lot of other healthcare workers, that's not the case. And I know multiple people, multiple co-workers that have tested positive from COVID, from unfortunately being exposed to patients that have COVID-19. Is there actually a PPE shortage during the pandemic? So now that I'm in the healthcare field, I watch so many different healthcare professionals on YouTube or med influencers that I can't remember exactly who said this, but I just remember before I started my job, I was watching a girl's video, and she's a nurse, and she was talking about how her facility, they were running out of masks, and they were telling people to like reuse the same mask basically, and was only handing out one mask per week. And I remember watching that thinking like, that is crazy, that is absurd, because at the COVID testing facility that I worked at, we had masks and like we had like boxes of masks. Like if you wanted to switch your mask throughout the day, you could. No provider would get mad at you for getting too many masks or anything, and that kind of was a smaller facility. But then I got to my new clinic, and the clinic administrator was walking around handing out masks, and I'm like, okay, so they give us a mask every day. And then somebody told me, they were like, no, we get one mask per week. And I'm just thinking like, what the hell? Like, you guys, I'm not saying that the PPE shortage never happened, but I'm saying now if clinics are still giving out one mask per week, it's likely because they don't want to pay for them, because at this point masks have been mass produced, and even at my retail job we can grab as many masks as we want. So I honestly find it quite ridiculous that at the clinic that I work for now, we only get one mask per week. I don't know if people in this clinic are using that one mask or what they're doing, but me personally, I just bring my own, because who's finna play? So I change mine after lunch, so I'm pretty much going through at least 2 masks in a day, not one per week. So yeah, I don't know, it's pretty ridiculous if you ask me. So unfortunately, if you're wondering, yes, the PPE shortage is a thing in some healthcare facilities. Is it hard to wear a mask all day long? So for me, wearing masks has basically just unfortunately became a normal thing for me. It doesn't really bother me anymore because I basically have a mask on my face 24/7. But a personal issue that I have been battling is acne, because you guys, before, I swear, like even in high school and stuff, a lot of kids go through those phases of having pimples and stuff. I was blessed and I really never had problems with my skin. I pretty much always had clear skin. My skin has been pretty decent, but ever since this mask thing has started, and I have no other choice but to believe that it's the mask and obviously the makeup. And I guess I could stop wearing makeup. Like a lot of people have just stopped wearing makeup because they're wearing masks all day, but it's like that's just what I do. Like, I'm sorry. So now, unfortunately, I have a lot of dark marks on my face from where there were pimples and they went away. Either I scratched them or they just went away and they formed dark. So I do eventually gonna have to do something to get my skin back together, but I don't know what that's gonna be. Other than that, sometimes I feel like it's annoying when I hear people out complaining about having to wear the mask, or be like, oh, it's so hard to breathe in these masks. And I'm just like, I literally have a mask on all freaking day working with patients. Like, you can be courteous enough to wear a mask at the freaking grocery store. How do you feel as a healthcare worker in general about the pandemic? So lastly, overall, I just want to say right now during the pandemic, obviously it's a scary time to be working in healthcare, but it's also a scary time to be working any job, because you just don't know. You could get sick at any point or anything could happen. So overall, I mean, I feel kind of okay, so in the back of my mind, I feel scared, but at the end of the day, this is my job. Who wants to feel scared or sad every day? So at this point, I basically kind of just, it is what it is. I put it in the back of my head. I still have a nice day, and I just practice social distancing and washing my hands. But at this point, I cannot walk around in fear. Like, basically, the best advice that I can give you is to listen to the CDC and stay home. It makes me so mad when I go out in public and people complain about other people not wearing masks, and yes, they should be wearing masks, but my thing is, if you're going to be that offended or that afraid of someone else not wearing a mask, then just stay home. Like, why are you out anyway? The CDC already told you to stay home, and I feel like a lot of people are not listening. Like, they think COVID is for play. Yeah, y'all don't even know. I know people that work in the education system, and there are just multiple teachers where I live that have COVID and are out right now due to COVID. And then also, I work in the healthcare system. I know multiple people in the healthcare system that have COVID and are out or have been out. And I'm not just talking like other MAs, other nurses. I'm talking about the physicians, the people that are supposed to be keeping us safe and saving our lives. There's also multiple of them with COVID. So please, please, please wear a mask. But if you can't wear a mask, or if you're offended by other people not wearing a mask, then just stay home. That's the best advice I can give you. And you know, prayer, that's what I've been doing, is wearing my mask, my PPE, and staying prayed up. And at the end of the day, I mean, I'm just working in healthcare during the pandemic. So if you're not already subscribed, I hope you hit the subscribe button so you can be a part of the Myi mob, and I'll catch you guys in my next video.